How do cancer caregivers cope with anticipatory grief and loss? Caring for someone with cancer can be a deeply emotional journey, especially when facing the possibility of losing a loved one. Caregivers often experience anticipatory grief, which is the sadness and anxiety that come before an expected loss. It's a natural response to the ongoing changes and the uncertain future. To handle these feelings, caregivers use a mix of emotional, social, and practical strategies that help them stay strong while supporting their loved ones. One of the most helpful approaches is allowing themselves to feel and express their grief. Instead of bottling up emotions, caregivers find it beneficial to talk openly with trusted friends or family members. Writing in a journal or seeking counseling can also provide a safe outlet for complex feelings. Addressing unresolved issues with the patient, if possible, can bring emotional closure and reduce feelings of regret or guilt. Learning about the specific cancer type, treatment options, and possible symptoms can also make a big difference. When caregivers understand what to expect, they feel more in control and less anxious about the unknown. This knowledge helps them prepare emotionally and practically for upcoming changes, which can ease the burden of anticipatory grief. Building a strong support network is essential. Connecting with family, friends, or support groups offers emotional comfort and practical help. Sharing experiences with others who understand what they are going through can lessen feelings of isolation. Having help with caregiving tasks also prevents burnout and keeps caregivers healthier physically and emotionally. Taking care of oneself is vital. Caregivers should prioritize their own sleep, nutrition, and rest. Engaging in activities they enjoy and maintaining social connections outside of caregiving duties can recharge their emotional batteries. These self-care practices help them stay resilient and better equipped to handle the emotional ups and downs of anticipatory grief. Family resilience and good communication play a key role. When families share responsibilities and support each other, caregivers feel less overwhelmed. Open conversations about fears, hopes, and practical concerns foster a sense of unity and emotional strength. Practicing mindfulness techniques, like focused breathing or staying present in the moment, can help caregivers manage overwhelming feelings. Mindfulness encourages non-judgmental awareness of thoughts and emotions, making it easier to stay grounded during stressful times. Many caregivers find comfort in redefining hope. Instead of hoping solely for a cure, they focus on creating meaningful moments and cherishing small joys with their loved ones. Celebrating shared experiences and making positive memories can bring emotional relief and a sense of purpose. Seeking professional mental health support is also highly recommended. Therapists or counselors can provide tailored coping strategies and a safe space to explore feelings of sadness, helplessness, or anxiety. Professional guidance can be especially helpful when grief becomes overwhelming or persistent. In cases involving testicular, cervical, or reproductive cancers, caregivers often face unique emotional challenges related to intimacy and reproductive health. Open communication about sensitive topics, addressing sexual health concerns, and accessing specialized support services can make a significant difference in managing anticipatory grief. Overall, coping with anticipatory grief is a holistic process. It involves expressing emotions, gaining knowledge, leaning on support systems, practicing self-care, and seeking professional help. Each caregiver's experience is unique, and it's important to remember that there is no one-size-fits-all approach. Encouraging caregivers to take care of themselves while caring for others helps ensure they can navigate this difficult journey with strength and compassion. Always consult healthcare professionals for personalized advice and support tailored to individual needs.